This is Ashley at Portland Wellness Care, and I just wanted to go through a little option for helping to relax all the muscles around the back, especially when you're feeling really sore. And I also wanted to talk a little bit about proper diaphragmatic breathing. So for this setup, we'll be lying on the ground, and you'll want to have a chair or a bench or even a low bed, something kind of like this block here that will allow you to rest your legs on it in a 90 and 90 degree position. To get into this pretty easily, you just scoot your hips up as close as you can to your chair or wall, and then roll onto your back, kind of teddy roll. You'll get your legs up, lie all the way down, and then you can just wiggle your hips closer. So ideally you have your knees at least 90 degrees. A little higher than 90 is also okay. But you want to make sure your thighs are pretty much vertical, straight above your hips. From here, you can rest one hand over your belly, one hand over your chest, and the goal here is to fully just let everything relax, feel supported by the ground, let all the muscles around the pelvis, the belly, and the chest just totally get soft, and spend a few moments just breathing as you normally breathe. And while you breathe, pay attention to which of your hands is moving, the one on your chest, or the one on your belly, or both. A lot of us have a tendency to breathe with our chest, which makes sense because our lungs are high up here, but our major breathing muscle is the diaphragm, which sits nice and low through the lower part of your rib cage. As you inhale, your diaphragm should contract and press downwards against your abdominal organs, so you should feel a little expansion through your belly when you breathe in. When you breathe out, the diaphragm will lift back up and remove the pressure from the organs in the belly, so the belly should come in as you breathe out. Over time, a lot of us sort of lose connection to our diaphragms, our abdomens, and even the pelvic floor, all of which have a part in the rhythm of breathing. And we tend to overly rely on the shoulders and chest to perform breathing for us, which is what would happen in a stress state as when you're running. But since most of us don't spend our entire day running, we should be able to just breathe normally and neutrally with the abdomen and with the diaphragm. So to focus on diaphragmatic breathing, keeping one hand over the belly, one hand over the chest, see if you can focus your attention on the hand on the belly and initiate the breath movement with that hand. So feel your belly naturally pressing up, and then when you exhale, try to feel that hand moving first and moving more than the hand on your chest. It usually takes some time to repattern this if it's been a while, but since you've paid attention to your breathing, and if you do notice that your chest is moving a lot or only your chest is moving and not your belly. So it's a good idea to practice frequently, taking breaks throughout your day, hand on one belly, hand on the chest, just to check in with your rhythm and see if you are paying attention and noticing. If things have been kind of out of whack for a long time and your body is automatically breathing with your chest, it will take some time to change the pattern. So work on it frequently. Breathing into the belly, letting all the muscles through the legs, the back, the pelvis relax. So practice this frequently and see if it makes any difference in tension through your pelvis, neck, shoulders, and back. Hope this helps. Thank you.